it saved my life. There's no doubt. I haven't really shared this part of my story, but I'm not a compliant patient. You can see that as far as the doctor asking me to do the testing, and it took me 9 years. But I'm also not anyone that goes to the doctor. Women are tough, and we just don't go to the doctor. And when you look at the vague symptoms of ovarian cancer, bloating, what woman doesn't have bloating? Feeling full when you eat. Well, okay, isn't that what we're supposed to do when we eat? Is feel full? I mean, all the things. The vague symptoms of ovarian cancer never would have sent me to the doctor. Everyone that knows me knows that's true. I would have been stage 4 when I presented, and I wouldn't be here. I owe my life to genetic testing. I really believe I do.
This is Genetics for Healthcare, a podcast for patients.
This is Genetics for Healthcare, a podcast dedicated to helping patients and their caregivers to advocate for a precision medicine approach to treatment, disease, screening, and prevention. You can follow us on Spotify, Apple Podcasts, YouTube, LinkedIn, any of those platforms. Just hit that subscribe button and get alerts and updates on new episodes like this one. I'm thankful to have Kathy Baker, CEO of My Faulty Gene, coming on. She's got a great story and she's doing great things through her organization to help a lot of people. Kathy, thank you so much for being a guest on the podcast.
I'm thrilled to be here.
Tell us about My Faulty Gene and what does the organization do, and really what inspired you to launch the organization?
Well, we have 2 missions, really. We educate and we assist. And it's kind of at times it's equal parts. It depends on funding and where we are on funding, how much we can assist, but we also educate. And knowledge is such a powerful thing if you do something with it. And so we want people to understand that it's great to know. It's great for us to help them in the ways that we do with genetic testing, with funding patients maybe who aren't meeting criteria, different things that we can assist. But if they don't do anything with that information, what good is it? In my own life, it was life-saving for me having genetic testing. So my faulty gene was kind of my pay it forward in life.
So already really powerful that I heard a while ago that, information, like knowledge is power, but it's not powerful until you apply the information, right? And especially as it comes to accessing these genetic insights for prevention, screening, or even treatment or clinical trial implications. It is both, and I appreciate you saying that. To educate not only ourselves as people who can screen and get ahead of some of our disease processes, those who may need treatment, but also educate them how to partner with their doctor. So you were first diagnosed with breast cancer, but you declined genetic testing as they suggested to you. Tell us about that and how you kind of got from there to actually being tested.
It was when I was diagnosed with breast cancer, it was the year 2000. So they'd only been testing for the BRCA gene mutations for about 4 years at that point. So it was not a subject that was talked about. And when my oncologist suggested testing right after I was diagnosed, I just kind of looked at him like he had horns. You don't need my DNA. Why do you need my DNA? And I didn't really understand that my family looked like a poster family for some type of a mutation. So, I was in a wonderful care facility for my cancer treatment. But it was in a community hospital setting. There was no genetic counselor.
Mm.
And the doctor, my med onc, only had so much time to talk to me about that, and that wasn't. He just knew he needed to push it with me, but didn't know how to convince me. And so every year for 9 years, 9 years after my breast cancer diagnosis, every year when I would go for a checkup, he would ask again if I'd thought any more about genetic testing, and
Wow.
I would tell him, "No, but I will," but I didn't. Um, and you might wonder why I mean, I was stage 2B breast cancer, so I was not a long-term treatment patient. After a year or so, I was, through with my treatment. but I did continue to see him because my mother was also his patient, and she was legally blind. I took her to her appointments, so I was always in front of him, so I couldn't get out of not going for my own checkups. So I did continue with those checkups, thankfully, and interesting story, in year 9, a rep from the testing lab where, that was providing all the testing then at that point, Myriad, got an audience in front of my provider, Dr. Frank Ward, and he said, he shared a study. It was called the Metcalf study, and it was a study of 491 women with a known BRCA mutation. And it was looking at that had had breast cancer. Okay, so that's the two things: known BRCA mutation and had breast cancer. And they also early stage up to a 2B, which is where I was. And they were looking at what was the likelihood these women would go on to get ovarian cancer. For a BRCA2 mutation, it was one in a 20-year period. In a BRCA2 mutation, it was 1 in 7. BRCA1, it was 1 in 3. So when my oncologist learned that information, he was like, this family looks like a BRCA mutation. My sister had been the first to be diagnosed with breast cancer, and she was 32. Um, our mother had had 3 different primary cancers, including a DCIS.
Mhm.
Her father had died of a very aggressive prostate cancer that was diagnosed when he was 59. His mother had died of pancreatic cancer. So, I mean, we were checking all the boxes for a
Yeah.
BRCA mutation.
Wow. So
Yeah,
first of all, good on him for being sharp enough and aware enough
absolutely.
to just kind of hold this and just continue to offer. I think
Yes.
that's powerful. That's good.
Yeah, great physician. I mean, he absolutely saved my life. Um, so when he gave me a reason to understand, I'm educated. I wouldn't have just ignored it. And this was pre Angelina Jolie effect, right? She had not come out at this point with her um, proactive surgeries, and so this was early still, 2009. And at the time, actually, my mom was about to pass from cancer, and so
Mm,
he just caught me at the right time. I said, "Sure, I'll test." My sister was also his patient, and she also tested, and we were both positive for a BRCA1 mutation. And unlike my sister had had a double mastectomy, and she had already had a total hysterectomy with bilateral salpingo oophorectomy, so she was not at risk like I was. When I had had my, breast cancer, I'd had lumpectomy, so I still had breast tissue,
mm.
and I still had my ovaries. So, knowing that, I promised my mom, and I waited until she passed 6 months later, and then I went forward with risk-reducing surgeries, and that's kind of, that was the point. I was just thinking, one and done. That's kind of what you think when you've had breast cancer, but it's so important for women to understand that have had breast cancer. Mine was 9 years later that I tested positive, and as it turns out, it was a life-saving catch for me because when I went forward with my risk-reducing surgeries, I did 10 hours of piggybacked surgeries at Baylor Hospital in Dallas, double mastectomy followed by complete, total breast reconstruction, and then total hysterectomy with bilateral salpingo oophorectomy, and uh-oh, I have early ovarian cancer.
Okay.
Nothing
Wow.
not totally unexpected, no one expected it.
Wow. Okay. Wow. Wow. Sorry.
Yeah,
Okay. Wow.
so that it saved my life, there's no doubt. I haven't really shared this part of my story, but I'm not a compliant patient. I mean,
Mhm.
you can see that as far as the doctor asking me to do the, testing, and it took me 9 years, but I'm also not anyone that goes to the doctor. I have a busy schedule, busy life, and, women are tough, and we just don't go to the doctor. And when you look at the vague symptoms of ovarian cancer, bloating, what woman doesn't have bloating? Feeling full when you eat. Well, okay, isn't that what we're supposed to do when we eat is feel full?
Yeah.
I mean, all the things. The vague symptoms of ovarian cancer never would have sent me to the doctor. I would have been stage 4. Everyone that knows me knows that's true. I would have
Yeah.
been stage 4 when I presented, and I wouldn't be here. So I owe my life to genetic testing. I really believe I do. And So, my I'd long been an advocate for patients from the time that I had my breast cancer diagnosis. I've been involved with American Cancer Society for many, many years in many capacities. I'm a voice of hope for them nationally. I've done many things with them, but they weren't really doing anything at that point in the hereditary cancer space. It
Yes.
wasn't getting any attention.
Yeah.
So
I
at that,
I I
yeah,
wanna get to your advocacy work in a minute. I wanna dig
okay,
into that in a second,
okay,
but I wanna go back and make sure that those who are listening understand how significant, the decision that you made to go through the prophylactic mastectomy and, removing the ovaries and uterus through that surgery where they found ovarian cancer at its early stages. Ovarian cancer is referred to as a silent killer because it, like as you said, it's kind of symptomless. Like do you
right.
feel full? Sure. Like are you bloated? I'm bloated right now. So these types of things, and 70%, nearly 75% of women are diagnosed with ovarian cancer in the advanced stage. So that's a major decision. What was the conversation like, not only with your doctor when you had the conversation, but also as you shared that with your family to also get tested? Like, what was the impact even broader than just your decision?
Well, everyone understood the importance at that point. I'm not going to say everyone jumped in immediately, but it didn't take long. And I can say that all of my first degree relatives have tested.
Mm,
All but
okay.
one of my second degree relatives have tested. Many of my third degree relatives have tested, including we just got a result last week from someone who had not tested, and she finally did. And so, we have 8 family members known to share our mutation now, including a couple of my children, and so I have grandchildren at risk. So
Mhm.
this has been totally empowering for my family to know, um, so that they can be proactive in their own healthcare. I have a brother who shares my mutation, a brother and a sister,
Mhm.
and I'm one of 5, so 3 of the 5 of us share the mutation, and my brother does everything that you should do. I mean, he's like the poster for a man to follow. Does everything. He goes every 6 months. I mean, he has an exam. He goes for prostate screening. He does skin screening. He does breast screening. You know, I'm trying to talk him right now into the getting into the Precede consortium for the pancreatic screening, because 'cause I'm doing that as well out of UT Southwestern. And, just, we have a family history, and to catch something early means all the difference.
Yeah,
But yeah,
absolutely.
another thing for ovarian cancer, they call it the silent killer, they also call it the cancer that whispers.
Oh,
And I don't I don't listen to whispering very well. You have to yell at me to get my attention, and so, um, that when we came out of surgery and I found out what they had found. I mean, I was as shocked as they were. We were all shocked. I mean, totally blown away.
yeah. I'll say this: I'm a leadership uh, coach for medical and pharma sales organizations, and I always have tried to instill in leaders that lead and motivate leaders. You really have to value the work that you do. Like, to be in this field, in any field, but especially in healthcare, and have the privilege of marketing a product or a service that can help a cancer patient, because my father is a colon cancer survivor. To really value what you do, because as you mentioned, you live in East Texas, and there was a sales rep, and as I understand, you recently spoke at a Myriad national sales meeting. Can you just speak to um, how important a job they have? Because folks in the industry listen to this. In spite of the challenges sometimes they have with getting in and actually having a meaningful conversation with a healthcare provider, how important their job is to educate the medical community about not only hereditary cancer testing, but other genetic tests that can inform care. What's at stake each day?
You know, I see all of those people, no matter what the company is, I see them all as superheroes, I honestly do.
Mm.
Because I mean, they all need their capes because they are going out and they are having a hard time getting in to see doctors. I mean, that's just the way it is. But what job do you have that you can actually go in and sell something that can potentially save a life? It's not like you're selling, and this I'm taking this actually from what my Myriad friend Bill shared recently at that conference. But what other job can you have that you can actually it's not like you're selling a car that they don't need or something,
Yes.
this
Yes.
is something that people can benefit from. And after we met, several years ago, he had been telling my story but didn't know my name, HIPAA and all that, and after I was several years into the My Faulty Gene, our nonprofit, um, we met, and he realized who I realized who he was and his role in all of that, and it was kind of an interesting thing, so that was maybe in the summer. By, Christmas, I sent an edible arrangement, okay, to him for his family for Christmas. And they delivered it. He tells his story. He said they delivered it. Everyone's like, "Who's that from?" And he said, "I don't know. Let's look at the card." He looks at the card and it said, "Thank you for the last 13 years. Love, Kathy Baker."
Ugh.
He said, all of a sudden, his kids are like, "Who is Kathy Baker?" And he said, for the first time in their lives, they understood that what dad does makes a difference. And he became a superhero to his kids. And since then, and since he knew my name, he's kind of got this thing as he tells his reps, "Go find Kathy." How many Kathys are there out there?
They're
How
out
many
there.
women? I spoke
Yes.
at a UT, East Texas medical breast cancer event this last fall, and, um, after I shared my story, all of these women who were breast cancer survivors were just lining up, wanting to get signed up to do genetic testing because they realized it doesn't necessarily mean one and done because you had it some time ago. You still could have a predisposition
Mm.
to cancer, and learning that can be life-saving not only for you, but for your entire family.
I'm gonna get into that also because at the top of this, you said you educate, but you also assist. So I want to get into that in a second. But I thought it was really interesting that you said you remember the study,
Mhm.
the Metcalf study that demonstrated the importance of genetic testing. And I hear you got to meet some of the authors that participated in that research. Tell us about that.
That was kind of a cool thing. I do go to lots of conferences because I want, oncologists to be aware of the services we provide, and
Mhm.
I also putting a face on hereditary cancer also is something that is impactful for physicians, I have found. So I go to a lot of conferences, and um, Dr. Funmi Olapati had asked me to, I mean, and she's like a guru in genetics, and she had asked me to come to a conference she was having, and they do it jointly with City of Hope every other year. One of them hosts it. I'll be actually next week at City of Hope's conference in Los Angeles. But anyway, Dr. Olapati said, "Please come." And on the fourth invitation, I said, "Okay, I'm coming." Um, and so I get to this conference and am talking to this gentleman and who ends up being one of the authors of that study. I didn't know it at the time, but he was asking, why do you do this? And I said, well, I'm just passionate about it. It's my pay it forward in life. And he wanted to hear more. And I said, yeah, the Metcalf study was a study that actually just changed my life. And he said, "Well, she's here at this conference." And I said, "No, no, I didn't
Yeah.
know." So as soon as I saw Dr. Olapati, I said, "You gotta introduce me to Dr. Kelly Metcalf." And that night we met, had her picture made, and then, I've actually done a couple of things with her since then, and great, great person who has her study has saved many lives. And she's got lots of studies, but that one, I think was in 2004 or 2005. And it's been very impactful. So it's exciting that we were able to meet and become friends.
Yeah. Oh
Dr.
man.
Steve Narod as well, and also Dr. Olapati was part of that study, as well as, um, Henry Lynch, he was part of that study as well, so a lot of people that are familiar.
It's great to see and hear that come full circle. It just puts, as you said, it puts a face on it, but it just makes it real for even people like myself who want to empower patients out there how to have the language to advocate for themselves and understand why it's so important. Okay, I don't want you to miss also that you just mentioned um, that it's not a one and done thing. Even though you might have a a let's say you don't have a pathologic mutation, you don't have BRCA, but you might have variants of uh, unsignificance, right? Variants of unknown unsignificance. They're called VUSs if
Right.
in the industry. What implications do VUSs have, and how should patients deal with that?
Well, a lot of times patients aren't aware that they have a VUS, but if they are made aware, then they're kind of concerned. The way that the industry is, the studies show that for every variant of uncertain significance, if it's reclassified, if they get enough information so that it can be reclassified, they've seen enough people with this particular mutation, and it's reclassified, 91% of the time, it's downgraded to benign. But there is that about 9%, 9 to 10% of the time that it's upgraded to pathogenic. And so that's very important to know. The labs let the doctors know. There is some issue and some concern because some people, they are hard to keep up with. Doctors move, patients move. So there is concern. But, if someone's interested, and this is one thing I do for people as well, if they have a bus and they want to know what the status is, and I mean, they can always contact the lab that did the test for them if they're aware of that and check on status. But we go on to ClinVar and we check that for patients as well. And we actually recently had one that we assisted with that had been upgraded. It was a Lynch, an MLH1 mutation that had been upgraded from a VUS to pathogenic that
Hmm,
we were able to share with that patient.
that's awesome. So, do you guys help those who may need to connect with genetic counseling, or if in their insurance program may not pay for it, or they may not have a designated indication? Do you help with those services as well?
We do, and we've done this in many ways. Again, depending on we're a small nonprofit, although we are national. We've funded testing and genetic counseling in 40 out of the 50 states in the
Hmm.
U.S. Um, we have, but we have a pretty decent um, social media presence that we've developed, and we're only 5 years old. So I was looking at the numbers for the 2024. We had amongst our different social media avenues, we had 3,458 posts that we had.
Wow.
We had we have 10,625 current followers, and we
Oh,
had 2,041,444 views last year.
let's go,
So
Kathy.
so
All right. Yeah.
who knew what one person could go out and do and the difference that a person can make, but if you're passionate, you can, and I am. And so the reason I bring that up is through social media, we've had some promotions, campaigns where we'll say, if you have a family member with a known mutation and you've never tested, we'll test you free.
Hmm. That's awesome.
And we would do a patient-initiated test, with the labs that allow us to do that. And, in doing that, we've really found some crazy, crazy stories. One was a patient whose daughter had a BRCA2 mutation, and she wanted to know if it came through her. She had not had cancer, her husband had not had cancer. So we tested her, and in fact, she did have the BRCA2 mutation. She also had an APC mutation.
Hmm.
And this is my pitch for when you're doing testing, I'm very much into doing panel testing as opposed to just a single gene,
Yes.
because you don't know what else there is out there. Um, anyway, so she had both of those mutations. Well, she had twin sons, and she asked um, one of her sons asked if he could also be tested. We tested him, and he had both BRCA2, he had APC, and he also had BRCA1.
Wow.
So we tested dad. Dad had BRCA1, and the twin brother tested, and he had all 3 as well.
Yeah.
And this was in a joint, campaign that we were doing with J-Screen and Kick BRCA. So this was we like to work with other nonprofits very much. I mean, we're much stronger together, and so that was part of a campaign that we had, but, I mean, that was life-changing for that family.
Yeah, it was.
Um, we had one another this is kind of a crazy story, but another example of why it's important to go to conferences. A doctor I met at a conference had a patient who had a nodule on her thyroid, and she was not, meeting criteria. She was a Medicare patient, not meeting criteria for testing. He said that she had had uterine cancer in her 20s, but you have to be currently affected under the Medicare guidelines. So he said, I need help with getting her tested. She has a daughter who's had breast cancer, and the daughter did not do testing. So we'd like to test and see if she has a mutation. Well, anyway, long story short, she had a TP53 mutation, which is Li-Fraumeni syndrome, and you've got about a 100% chance that you're gonna have cancer. Well, as soon as her doctor saw that, he removed that cancerous thyroid, and the rest of the family was able to test, and the rest of the family, all of her kids had the mutation, and grandkids as well.
The net takeaway that the big takeaway on it is screening, genetic testing, germline genetic testing, understanding the mutations, the genetic variants that you were born with, that you may have inherited from your mother, your father, or someone in your lineage. It's important. It can be life saving to screen ahead of time, because you could be in a position where your health plan will pay for earlier screening, more comprehensive workups in order to prevent a diagnosis or catch them early. I think it's also important, Kathy, to let people know, because in the 5 years that you've started your organization, the NCCN, the ASCO guidelines for germline genetic testing have changed dramatically.
Yeah,
Um, Today, there are 5 or 6 tumor types: breast, ovarian, pancreatic cancer, colon and rectal cancer, prostate cancer, where germline genetic testing is guidelines. It should be standard of care. But as we mentioned earlier, many times when you come in to be treated for your cancer, it may not be your medical oncologist who introduces this to you. So go in and ask questions. We'll get to those questions that you may have to empower those patients in a minute. But again, your advocacy work that you're doing through My Healthy Gene, you mentioned that you were named a voice of hope by the American Cancer Society. Again, folks, my faulty gene's been around 5 years. Voice of hope for the American Cancer Society. You're a part of the American Cancer Society's National Breast Cancer Roundtable. And you talked about the dynamic social media reach, which is oh so very important. Um, I believe that even with the innovation that's happening, is happening so fast that many of the treating clinicians don't keep up. Like, they go to conferences, they can learn about this stuff, but it takes people like you, Kathy, and My Faulty Gene to stand in the gap. How important is just social media, being where the people are, maybe searching? How important is that to engage and to help inform patients and their caregivers on
it's
genetics?
very important, but it's also scary because there's a
Mm,
responsibility with that you're giving good information, and unfortunately, there is some information out there that's not great, and there's some stories that are not good, but everything that we do, we use government, CDC, NIH, anything that's a government publication, because we can access that without permission. It's open to all of us to use, and that's our resources for all of the information that we share. So I feel like we have some good information there. But yeah, sometimes we had a call. Kudos to doctors that don't have any knowledge, but still recognize that there's a need for genetic testing. I know that there's lots of programs out there now. Cancer IQ has one where they will go a doctor will have a intake form for their new patients. When they put on their health history in there, it's going to kick out a report that may say, "Hey, this person might benefit from genetic testing." So some of these primary care physicians with no background at all in hereditary
Mm,
cancer are ordering testing, but they don't know what to do with it
yeah.
when they get those positive results, and that's the concern. And a good example of that is we had someone who contacted us on our 800 number, and she had the day before learned she had a BRCA2 mutation, and it was one of those situations where the PCP ordered the testing, and then when she came in and he gave her the results, he said, "There's 2 things you need to worry about with the BRCA2 mutation. You need to worry about breast cancer and ovarian cancer." Well, he's right, you do need to worry about those things, but that wasn't all she needed to worry about. Long story short, she had, gone to the doctor for something unrelated, had a CT scan some months before. Something had been seen on her pancreas. And so she asked me, she said she'd found us, she'd been reading our posts, and she wanted to know, about if should she be concerned about a possible pancreatic cancer. And of course, my response was, I'm not a medical professional. I can't give you medical advice.
Right.
I said, but as a patient, I can tell you what, if it were me, what I would do.
That's awesome.
And in dealing with the pancreas, I would go to a teaching hospital where someone sees a pancreas every day as opposed to at a community hospital where they might see it, you know, 3 times
Yeah.
a month, if that many.
Yeah.
And her physician, when she had asked about it back when there was this shadow on her pancreas, I said, "Oh, no, that's nothing. That was just a glitch in the film." She said, "Is it something I should worry about?" I said, "I would go to just get checked out. It's probably not. Probably is a glitch in the film." Long story short, she did follow up with my advice, and she had early pancreatic cancer. She had Whipple surgery, and she's currently cancer-free.
Awesome.
So education works, and you don't usually I can look at tests, and I can see of the hundreds of tests that we have funded for patients who couldn't afford it, I can tell you that, the over 100 patients that we've identified, the mutations that we've identified, we can see those results, but we can't usually see what our educational efforts do.
Yeah.
Which kind of leads me to I'd like to have just a minute to talk about
Mm,
my passion right now. One way we're trying to educate more people is through a video series that we started, and it's called Family Gene Share. And there's a website for it. It's just familygeneshare.org, O-R-G. It's actually also .com. You can find it either way. But it's compelling short stories of patients who've been impacted by hereditary cancers and how, I mean, just different genes, different cancers, and we relied a lot on people from other, advocacy organizations because, again, we think we do better when we all work together, and so we've got some leaders from different, advocacy groups that are involved in that, and we had our first 17 videos that were released last July, and in the first 10 days, we had 10,000 views. It's kicked back since then. We're trying to get those out there, but we are about to release our second set of videos. There's 7 of them coming up, and one of them includes, uh, a country and western singer, Morgan Wade, and so she'll get a lot of attention, I think, and she had has a RAD51D mutation and went forward with risk-reducing surgery herself. So that was a really good story. We have our first story in Spanish from a patient who has both a BRCA mutation and a Lynch mutation. She has a PMS2, and some really, really compelling stories, good stories, to help and really our goal in creating this educational series is that patients, when they learn they have a mutation, they have a hard time talking to their family.
yeah.
And it's so important. And we wanted a tool that they could say, okay, watch this and see. We want you to understand why it's so important. And maybe they don't understand themselves. So these videos are helping to educate why it's so important and how it can impact entire families.
You guys are doing an amazing work with educating and assisting to increase access to genetic testing and precision medicine. Again, I appreciate your story of it being life saving, and also to remind us that none of us are better or smarter than all of us. So one of the things that I love to ask my guest is to share three questions that patients, cancer patients, their support team uh, can arm themselves with to go in if they find themselves in a situation with a cancer diagnosis or know a family member with a cancer diagnosis, that they can go in and ask their doctor to advocate for a precision medicine approach to their care or genetic testing. What are some questions that they can go in and ask in order to become a better partner with their care providers?
Um, Gee, I'm sorry I wasn't ready for that. I should have been. But, it's actually pretty easy because you need to go in and be honest with your fears, with your concerns. A lot of times you have so many things that you're concerned about. You're worried that it's a death sentence if you get a mutation. And so you need to go in and say, what would if I do genetic testing, if I undergo genetic testing, what can it mean to me for my life? And a lot of times that's not gonna b it's really the genetic counselor that you need to be talking to
Mhm.
because they're the ones that are trained and understand all of this. And most physicians are gonna give you a referral to a genetic counselor, but you just go in and you ask, "What can this mean for me and my family? And what can it mean for me if I don't do it?" And so that would be my encouragement to everyone when you're talking to your doctor, you know, if it was your wife, what would you tell your wife? What would you want your wife or your daughter to do? Would you want them to have testing? Would you want them to, do you think it's something that's, worthwhile? You know, because if you
Absolutely.
make it personal with them, then you might get a different answer. You might get their attention and get a different answer than you might otherwise.
Yeah. I think I want to make sure that people, because, folks, as you mentioned, may not live near a teaching center. They may live in rural Oklahoma or in areas where their healthcare system doesn't have that genetic counselor. Uh, how would you direct them to have that conversation or to connect with a genetic counselor?
Well, the NSGC has a great website. It has a tool on there, nsgc.org, and I think it's called findageneticcounselor.org also. I think that's another one of their, ways to find one, but you can put your zip code in there, and they can hook you up with a, genetic counselor. They can give you names and, phone numbers, connections, also, by whether it's somebody that you want to have a virtual conference as opposed to a sit-down conference. And a lot of those conferences have gone those appointments are virtual now, and that's fine. You get someone who's knowledgeable, that's great. You can, get a lot of education that way and learn more. And sometimes that's just the best place to start. But for sure, if you have a family member with a known mutation, it's hard for me to understand why you don't wanna know because not knowing the only thing that not knowing changes is your ability to act on that knowledge.
Yes.
If you don't have it, you can't act on it. And so, uh, I understand the fears. I understand the, concerns about, you've got Gina, you've got health insurance that protections. It doesn't protect you as to life insurance. So, we talk to people. We say, "You wanna do genetic testing? If you are concerned, get your life insurance in place first, and then go back and do it." You
Yes.
know, there's things to look at, but yeah, go to talk to a genetic counselor. You can get a referral through your physician, or you can get one by going online through the NSGC website.
Awesome. Knowledge is not powerful. Knowledge is potential, but applied knowledge is power. And Kathy Baker from My Faulty Gene is helping patients and their family members make that information more actionable and making a tremendous impact, not only in her family, but in families all over the world. How can they get in touch with you if they want to connect with your organization or for speaking opportunities? What's the best way for folks to get in touch with you?
We have a website. Well, we have the 2 websites because we have the My Faulty Gene website, which is myfaultygene.org, .org, which is our main website. And for someone who's seeking assistance, we up in the, gosh, I can't even remember the name, but we up in the, um, references, I believe, there's a reference section, and there are 2 forms to fill out. One of them is an application for assistance, and the other is a risk assessment. We're running a little behind right now on funding tests. We've got a little bit of a waiting list, because we are, donor driven. We don't have any backing for that for those, tests, but we will get to you, and if it's somebody that's needing it more urgently, we move those folks to the top of the list. But we've got the myfaultygene.org. It's got a lot of information on it. We're about to segue our family gene share videos where they're also on that website. Currently, they're not, but they will be. But the familygeneshare.org website, it's much like when you have a pharmaceutical company that has a drug and they have a website just for that drug. We have a website just for those videos because we're not trying to do anything or point anyone to My Faulty Gene. We just want to get those videos out. So that's the second video. We have our phone number. If someone wants to get a hold of us, is 903-747-2687. And we also have an 800 number, but I'm not giving that because no one gets charged for a long distance call anymore, and we would get charged for the 800 usage. So we'll just leave it at that.
There you go.
My email address is kbaker, KBAKER, at myfaultygene.org. We also have a donate button on our website if anyone wants to donate. We pay between $250 to $300 for each test and genetic counseling session that we provide, and there is a need for that. So, we just want, when I talk about why do I do this, it always comes down to how could I not?
Yeah, gosh.
How
Man,
could I
you
not?
inspire me, Kathy. You
How
really
I
do.
would not be here. I
Yeah.
look back when I share my story, which I do a lot. I do a lot of
Hmm.
speaking as a patient, and I show pictures of the things that I would have missed the last now 15 years. I would have missed the births of my grandchildren.
Yeah.
I wouldn't know them. They wouldn't know me. My kids wouldn't know they share my mutation, other family members. All of the things. I've done a lot of fun things in the last 15 years, but just imagine your own life, last 15 years. What would you have missed if you weren't here? So how can I not? I also uh, I spend all of our money on this, and I asked my husband, "Are you mad at me for doing it?" And he says, "No, because
Yeah.
I'd rather have you, and you wouldn't be here." So he gets it. So I have a lot of support from my family, and I appreciate it. But we can always use some more support. So get that
Absolutely.
out there as well.
And we will have all those helpful links and contact information for the 2 websites and Kathy Baker on our episode webpage on geneticsforhealthcare.com. Kathy, thanks again for being a guest on Genetics for Healthcare podcast for patients.
Rome, I appreciate you inviting me and giving me the opportunity to share my story and more about my faulty gene.
Absolutely. I understand your background is as an attorney. I see the tenacity. I see and I feel the tenacity of an attorney.
Well, I actually do not practice law. I was in the oil
Mhm.
and gas industry and I used it that way. But yeah, that was many years ago, that was where I started out and was interested in politics, actually. That's what I wanted to do. And then it was just shortly after my graduation from law school that my mom was diagnosed with her first cancer. And everything changed. And
Yeah.
then when my cancer, it all changed. And so my goals, everything other than being a local school board member for a number of years, that was the extent of my politics. But yeah,
Life has a way of redirecting our purpose.
it does. Absolutely. And I'm so thankful that I'm able to even do something in a small way to help others.
It's big. It is tremendous. You've inspired me, and I know you're helping a bunch of folks out there, and we really need it. Thank you for being a warrior.